All right, in this video, I'm going to take you through a quick demonstration of reflex cough testing. I'm going to be both the clinician and the patient. So in a previous video, I showed you the equipment that's needed to set up for reflex cough testing. In addition to the kind of formal hardware equipment, you'll also want a scale for patients to rate their urge to cough. The scale that's traditionally used is a categorical ratio scale ranging from 0 to 10. In fact, the true range can be above 10, but the numbers on it go from 0 to 10. These are the descriptors that are typically associated with it. Notably, patients can select any number, even a decimal. It doesn't have to be a whole number or a half number. So someone could say 1.3, 1.2. Most patients don't. Most people stick with a whole number or halfway in between. Yes. There are various methods used for reflex cough testing. With the setup that I showed you, you'll want to be doing a continuous breathing method, whereby individuals are just doing kind of normal rest breathing, and they're exposed to a stimulus upon inhalation of just their tidal rest breathing. So the instruction for reflex cough testing will be to breathe in and out through your mouth. I'll indicate that we're going to be placing this face mask around their nose and mouth, and that we want to prevent any sort of air leakage. So we're going to push with a moderate amount of effort, and that they should kind of push forward as well, so that we prevent as much air leakage as possible. We'll remind them to breathe in and out through the mouth. We'll let them know that we're going to turn on the compressor at some point. It's going to give them some fog that has a little bit of citric acid in it. It may or may not make them cough. They just cough if they need to. Then what we do as the clinicians doing the reflex cough testing is we look for 3 stable rest breaths. So just nice relaxed breathing, at least for the patient. Upon their 3rd or 4th exhalation, we turn on the nebulizer. So we're just kind of looking at their chest and belly. We turn on the nebulizer when they start to exhale. That way, fog is getting in the mask during exhalation. And then when they start to inhale, they are all exposed to the fog and citric acid. The idea is that we don't want to turn it on too late in exhalation so that they're exposed to the fog, halfway through their inhalation. We want everyone to have the same time when they're exposed to the fog, so immediately upon inhalation. So just turn it on during exhalation. You then keep the face mask on for 15 seconds or maybe 3 breaths, or until they cough, whichever one comes first. Typically, it's when they cough. When they cough, keep the face mask on nice and hard, preventing any sort of air leakage for 1 full epic. So, epic is where someone inhales and they have 1 or more coughs. And then another epic is when they inhale again and then recough. So we want to take it off. We want to take off the face mask when they do a second inhalation to start a cough, because we just want to measure what their peak flow rate is for that first cough epic. After they do it, after they complete 1 trial, we'll ask them to rate their urge to cough using this 0 to 10 scale. And we might let them know ahead of time that we're going to do that as well. So we'll tell them beforehand, we're going to give you some fog that may or may not make you cough. You just cough if you need to. Afterwards, we're going to have you rate your urge to cough using the 0 to 10 scale. So the instruction I might say is, all right, now we're going to look at your reflex cough. For this, I'm going to place this face mask around your nose and mouth. I'm going to push a little hard to make sure that there's no air leaking out of the side. Feel free to push back against me. So it's going to be nice, moderate pressure. I just want you to breathe normally in and out through your mouth, not through your nose, but through your mouth. At some point, I'm going to turn on that machine. It's going to give you some fog that has a little bit of citric acid in it. That may or may not make you cough. You just cough if you need to, whatever you would normally do. Afterwards, I'm going to have you rate your urge to cough using this 0 to 10 scale. Ready? Let's go ahead. So I'll be the patient now. Go ahead and look for 3 tidal breaths. It's going to look a little hard because I'm wearing black scrubs. I'll turn it on myself. Normally the clinician would turn it on. Let's take a look. So there you saw my 3 stable rest breaths. I turned on the device. I was making sure that we had good seal. I was also, as the clinician, you didn't see this, but I was looking at making sure they were breathing in and out through their mouth, so at least that their mouth was open. I kept the mask on for 1 full epic, and I turned off the compressor immediately. And then I took off the mask when I started to inhale. We can see here that my peak flow rate was around 215 liters of air per minute. And then ask, great, what was your urge to cough using this 0 to 10 scale? And patients might say, I don't know, I just coughed. That's okay, just give me a number from 0 to 10. And then I might say it was 7. It was strong. It was a strong urge to cough. Yeah, and then we might do that 1 or 2 more times for a total of 2 to 3 trials. Depending on what you're doing reflex cough testing for, you're going to either want to pick a solution that you put in here that's strong enough to make most people cough, so you can look at cough airflow. Alternatively, you might be a little less interested in airflow and more just interested to see how sensitive they are. So you might do a lower dose to see, or a lower concentration to see if it's something that they feel and perceive and cough to. So depending on the purpose of your reflex cough testing, you may pick a different concentration solution. I am typically more interested in knowing how good is their reflex cough, so I want to pick a solution that most people cough to. But if you're interested in identifying people who might have sensory deficits and you want to see are they able to detect something more subtle, you might do a lower concentration. If you've got the luxury of doing more than one concentration level, you can certainly do that as well. All right, I hope this was helpful.